Welcome to Thriving in the Workforce, Disruptive Dialogues with Leaders Who Care. This is a new series brought to you by Your Coach Health, where we'll be discussing top issues that are top of mind for HR and benefit leaders everywhere. And in every episode, we'll be asking the same question: how do we move the needle? Each guest will be given an opportunity to answer. If you had a magic wand, what is something that could be done to move the needle today? My name is Marina Borohovich, and I'm the CEO and founder of Your Coach Health, where we provide behavior change, lifestyle interventions, and mental health support in the form of life health coaching, either directly to employers or through our white label solution, powering up other brands, including digital health solutions, health plans, and EAPs. Today, we're joined by Jennifer Borislow. Jen is the founder and chief executive officer of Borislow Insurance, a leading provider of innovative health and well-being benefit solutions serving more than 300 businesses throughout New England. Jennifer is past president of the Million Dollar Roundtable and is a co-author of 4 books. She's an industry leader and active participant in several insurance company advisory boards. Jen, welcome. So happy to have you with us today.
Thank you very much. It's an honor for me to be here.
Super excited for this great conversation. And with that, I'm going to dive right in. Why do employers need brokers?
Oh, that is a
Nothing like
great
putting you on the
question.
spot, right?
Oh, you don't have to. This is the world I live in, so I am happy to answer this question. The Why does the world need brokers? Well, first of all, the landscape has changed considerably as to why benefits such a complex and constantly changing landscape. So you need help. Employers need help to navigate the competitiveness of a highly regulated marketplace with constant changes. And you need strategic brokers. You need brokers that are not just delivering the less bad renewal or sending you spreadsheets that, hey, these are the 6 or 7 carrier options you have. You need somebody who's going to actually create a 3-year roadmap into what is happening in the healthcare industry. So, brokers who are knowledgeable and have the expertise in this field are highly valued as a strategic advisor. And that's why employer groups need brokers today, because that wealth of information is very difficult to navigate.
And we hear that a lot whenever we talk to CHROs, talk to my broker. So there's a lot of conversations that are leading back to the broker these days. And how are they, just to level set for everybody, how are brokers different than consultants?
Actually, we talk about this all the time. Brokers and consultants they're similar titles that are interchanged. And what I would say is you take your typical broker who, for the longest period of time, was able to guide clients into their renewal decisions or their benefit choices by just spreadsheeting and saying all these plans look alike. Pick a carrier, pick a partner based on service or based on reputation or access to network. That's no longer the case today. And many of the brokers find themselves in that's kind of like a wedge market. Like you can do spreadsheets really well, but that is just passing over data. Consultants and being a strategic advisor, our firm, we consider ourselves strategic advisors. We are helping the client navigate not only those spreadsheets, because you still have to do the core work, but you are talking about what the future is and what the risk is of your group and what your group needs specifically that might be unique to that individual group that you need to address. Like the group may have a high cost claimant problem, and we need to address that, or at least acknowledge that and find a way to build the benefits around that and the services. So today, I would say being a broker is, access to carriers and information. Being a consultant is taking that data and really creating a pathway forward. And that's where we feel being a strategic advisor is a better terminology for how we define ourselves and the role we play with our clients.
You, you alluded to earlier, the employers, just everything from tax code changes, Section 125s. I mean, there's just so much complexity and so many tools. And why do you believe, or maybe that's not the case, we feel like a lot of employers, and actually more importantly, employees, don't even know what employers offer, right? There's just almost everything under the sun, and yet, where's the focus? And I think the second part to this is you're in the front lines, with employers and some of the decision makers. So to kind of combine the two questions, what are you seeing as the top challenges that these employers are having?
I would say the number one challenge today that most employers are facing is their HR teams and their CFO teams. The teams that manage the benefits are getting slimmer and slimmer, and their dependence on us as consultants is gotten greater. So the amount of knowledge and the amount of work that, let's just take HR professionals, CHROs, and HR professionals, what they have to do today on their plates, like ads and terminations and recruiting and benefit administration and payroll, and like their jobs have become so involved with day-to-day operations of the company that it's almost impossible for them to stay on top of the complexities that are happening in healthcare. And that's where we come into play. Like we are very specific with recommendations and a strategy moving forward. The employers today struggle with too much on their plate. So benefits is just one piece of their
Yep.
puzzle. They just don't have enough time to really understand the complexity of some of their decisions. If you're an employer where your plan is running well, for example, you have access to your data and you have positive claims experience, you have a pretty healthy group, your work is not as great as if you have an unhealthy group or an unexpected large loss or persistent claim activity, or like the GLP-1s have been a
Mhm.
huge topic of conversation lately. And you might have a lot of employees that are accessing that information, and decisions are now being made whether that is still going to be a viable offering for employer groups today. So there's just so many pieces to what the HR team has to manage each and every day that they need consultants and brokers to really help them navigate, and they need them to rely on them to take some work off their plate because they don't have the time. So what we're finding is the it just keeping up with the legislation is one part of it, but the plan designs and the funding opportunities changes every single day.
It's fascinating to me. You've mentioned the word data, I think at least three, four times in these first couple of minutes. And while on one side, we always say, data doesn't speak for itself. Actually, people speak and interpret that data. But this is where kind of you alluded to consultants and advisors and brokers come in, right? Sort of in a combined function. But how are you looking? I think, companies with technology advancements are getting more, while the data is getting larger, there are tools on the market. And I guess the question to you is how you're adjusting, how you helping these individuals or groups to make decisions based on data. I mean, there's everything from driving your benefit structure based on surveys, there's actual claims data itself, there's the outcomes of the promised solutions. So just curious, how you at Borislow think about data and making these decisions the best possible from an ROI and employee perspective.
So we really believe that data without any context to it is useless, right? It's just noise, right? That, here's all the data, we can provide all the data, and the analytics behind our engines now provides some really granular data. But if you don't have the data and transform it to actionable items, like what can we do to help either support like a positive data or help to change or help to inform what could be changed, then it's just as I said, noise. The data is noise. I think technology has allowed us to delve into the data and on a much deeper level today, which gives employers an opportunity to understand why they might be getting some of the rate increases, understand what's going on inside their population. It gives clients the ability to humanize a decision. Like, okay, if we are going to remove a specific drug off the formulary list, or we're going to change a drug tiering structure,
Mhm.
this is what it will do. It will impact your clients. It will impact your employees at this level. It will impact 10 employees. It'll impact 50 employees. So we are now able to get granular with the data to make very specific recommendations. One of the challenges that we're seeing today is that we we don't want to be the carrier that's just delivering the less bad renewal. I said that in the beginning, or the consultant. We want to be able to share with clients that there are different funding mechanisms to help pay and manage the cost of healthcare. And that can be anywhere from a fully insured plan where you are transferring all the risk to the insurance company. And we have plenty of clients that are very comfortable with that. Like they just want to pay their premium, have all their claims paid, to clients on the other end of the spectrum who want to be completely self-funded, design their own plan design, and have the ability to make changes where they feel it would be most appropriate for their company, and everything in between. And that's what we're seeing today. A lot of our conversations are now moving away from fully insured, especially in the New England marketplace. So I'm from the Boston area.
Mhm.
10 years ago, I would have said 95% of our clients were fully insured. Today, that number is only about 55% of our clients are fully insured, 45% are self-funded or in a captive structure. So
Listen,
that's how the market has moved.
with the healthcare increases, right? I mean, Business Group on Health, we just saw a survey, another 9% projected for next year. And I think tweaking and leveraging companies like yourself, being in a self-insured mode, helps these companies kind of try to manage that spend based on their own population versus a health plan just deciding, this is the rest of our risk management here, and this is what you pay.
Exactly. That's what we're seeing. We're also seeing an evolution of point solutions that are being added on to plans to help in specific areas like diabetes, mental health, weight loss management, pregnancy. So we're seeing more creativity with point solutions, especially in the self-funded platforms. It gives the employer more opportunity to control their healthcare spend.
It's kind of interesting you say that the point solutions, and we've been hearing there's this point solution fatigue. There's also, we strongly believe I'll say misunderstanding of wellness and culture and what it brings, because, the reality is, let's face it, while we all believe that long-term culture is a super strong asset and call it intellectual property, because ultimately, well, the intellectuals, right? Because that's the
Mhm.
people.
Yeah.
And from that perspective, then but you can't take culture to the bank, at least short term, right? So how do you look at wellness slash well-being and culture in a company? And what are your clients seeing this in this time when the cost is skyrocketing, right?
Well,
From a
because,
healthcare perspective.
just to add on to that a little bit, like we always talk about data and we love data around here, right? But ultimately, it's about the well-being of those individuals. Ultimately, we want the employees to feel better, to be better. They're healthier or happier employers, right? And I think a lot of the times in a shuffle, that is forgotten a little bit, when we look at the just hardcore numbers. So just curious how you feel about
So
that.
it's an area that definitely has lots of discussion around it today with the carriers. Some carriers still provide wellness dollars that employers can actually do wellness programs. But what we're finding is that true well-being, it's not about It's a philosophy. It's not about an app, right? You get on your app and you check how many steps you've done every day. If you live wellness on an app, it's going to be temporary. It has to be part of the culture, and not just a thought process or a philosophy. Wellness has the ability to be transformative if it's done right. So, and it has to have the encouragement of opportunities for access to maybe programs, maybe to data, maybe to understanding. It's so interesting that I have two adult daughters, and they wanted us to, as parents, to take this function app where you get like 600 blood test results by spending $500 and 10 vials of blood. And it was all over the news this morning that you can spend $500 and your whole, every blood test to possibly imaginable will be done, and you'll have the data to live a more healthy lifestyle. So our girls are in their early 30s. They feel like everybody should be doing this. And yet now I feel like our doctors should actually be working with us on coaching. And so it is either internally driven, and maybe that's the step we're going in, or it is a combination of you have to take responsibility for your own health and well-being. And what does that look like? And we can provide the tools and supports, but you have to embrace them.
Yeah. Well, it's all about intrinsic motivation, right? And people have different reasons. We have all the data, and you have exactly what you need to lead a healthier lifestyle. You have all these markers based on your blood type, but what now? What about these actionable steps,
Right.
right? And there is so much reliance on the healthcare, on doctors, on providers. They just don't have enough time. There's not enough of them, right? So, you mentioned coaching. So that's like our little gateway, right? Because obviously we live and breathe coaching, and happy to bring
Yeah.
that up the conversation any day. But that's what coaches are good at, helping individuals. Because knowledge is great, data is wonderful, but we always ask the question, what do we
What's
do
next?
with it?
What's
What's
So
next?
what's the
let
next
me
step?
ask, let me turn the table on you. I know this is your podcast, but now let me just turn the table on you because it was about, having all these blood tests. So would you say to your clients, this is a good thing? Like, go and do all these blood panels and come back to me. And I think it doesn't work unless you have a coach because
I
you're not going to do it on your own.
Absolutely. So coaches can't prescribe, right? So if you bring
Right.
the blood work to a coach, they're not going to say, oh, based on this, I believe this is what you should be doing. However, if there are recommendations that are given already, however, if your doctor has looked in these and said, okay, you know what, absolutely, like I agree that this is what we should be doing. Coaches, that's what they are. They're guides and mentors in helping individuals achieve those goals. So, both Eugene and I have coaches ourselves, and we like to think we'll live healthy lifestyles, but I don't think that could have been achieved based on our busy lifestyles, if we're doing this on our own. Like I feel like you always need a little
And
guidance and a
and
little
and
help.
we've and as you can imagine, because we're doing coaching and running a health coaching company and it's sort of forward, I mean, we've done a number of these tests, and this is what Marina's comment was. Yeah, there was one that we did. The doctor came out and said, things that obviously we've like personally been diagnosed with, et cetera. Great, but so what, right? What's the next? Now
Right.
so we're huge believers, and also remember, because of the healthcare system where we are and the cost going up, there's just not enough clinicians out there, and their
I
time is
agree.
6 to 8 minutes with every one of us, right? So who's going to fill the gap? But anyway, we,
So
we
I'll
can
take it
talk
actually
hours. Great. Yeah.
one
Yeah.
step further, so both of us did this, and yes, with Eugene, the doctor came out, gave options. With me, I got a text and they saw something off. Everything is fine, all is good,
Yeah.
but they saw something off. It was a Friday, wasn't able to talk to anybody over the weekend, and I'm sitting with this, right? Also not okay. Sometimes we get too much data and without the right person to interpret that data or the right team. And, I know we all speak about AI, but there's limits to what AI can do. We all need that human intervention and just we're all people at the end of the
100%.
day.
A hundred
Yeah.
percent agree. And you can look at the data and you can drive yourself crazy because in your mind you're thinking the absolute worst,
Yeah.
what the data shows or reveals. I just found it fascinating. This was a project that we did this summer with the kids. And they're like all over because my husband had a heart attack a couple years ago, and he's young. And they're like, Dad, you absolutely need to do that. And he, like, he loves his daughter. So off he went, got it done. And it's like strewn all over the counter. Like, what does it mean? And he's like, well, I'm going to see my doctor. I'm like, look, the only thing that we as a family have for ourselves is my sister's a physician. So we send them all to Aunt Becky, right? The kids sent their results on. That's the only reason we're able to not worry over a weekend.
Yeah,
But
for sure.
not everybody has access to an Aunt Becky, right?
It's funny, we
Exactly.
always say, we should have figured this out. Somebody should have been a doctor, somebody should have been a lawyer, somebody should have been
Right.
like, a coder, like just keep it all in the family. So you at least have
Yes.
something to
We have
talk
a
to.
Ha-
doctor and a lawyer, so we're good.
You guys did
Amazing.
But
good. Yeah, you
yeah.
guys did
But
good.
we are waiting for the next generation. So my niece is in med school, and we said to our kids, be nice to your cousin because she's going to be your doctor in the future. So,
Exactly. Be nice
yeah.
in general, but especially to her.
Yeah, exactly.
Yeah.
Exactly. So I
So
didn't mean to get off on a tangent, but I
No,
do
love
think
it.
that there's
Love it.
there's there's data um that there's tons of data. It's what you do with it, right? How you take it to the next step and how you interpret it and who coaches you. Like I am 100%, everybody should have a coach if they don't have access to their physician, which is harder to do.
yeah, a real coach.
And to be
Educate.
clear, coaches are not there to replace doctors. It's
Right.
work in conjunction with because of what we just talked about, right? 6 to 8 minutes to see you, but the behavior change and aspects of accountability happen in between the doctor's offices, right? So we're big believers of that.
But
Absolutely.
before we took it on our favorite tangent, which was wonderful, we talked about culture, right? About the importance of culture in a company, and especially from what we're hearing, everybody is big on building culture. But ultimately, you can't really take that to the bank. And at the end of the day, everybody wants to know the ROI. So, what is some of the ROIs employers are looking for?
Like
I know,
Oh,
KPIs.
that is such a
I know.
interesting. Hey, we're in the benefits business and like we have a wellness team. Like I feel like we do wellness to the nth degree. And sometimes I even shake my head and say, really, are we doing that? Like, why? Why? Get your heads down, back to work. But we totally support a culture of health and well-being. The challenge is you can't put a number on ROI. You can only put a number on really productivity. And it's not a physical number. It's like we know our team is better when they have access to some time off, some charitable opportunities to build their psyche, to work-life balance or integration. We call it work-life integration. We're purposely present at work, so we're a hybrid company. We completely morphed with COVID. We were an in-office company until COVID happened, and now we're hybrid. And when I say purposely present, we have 4 offices, and at no time are there more than 8 to 10 people in an office. So we do allow a lot of flexibility, and I think that that helps our work-life integration. What the ROI is, it's hard to say. I can't give you a number. We know that if we have productive and we have engaged and really thoughtful people working on our team, they're going to produce more for our clients. They're going to take care of our clients. They're going to be available for our clients. They're going to take that extra step, which is important to us.
Do you
So if
think
you
And
have a
you
magic way to identify ROI on a wellness point, bring it on. We'll be happy to listen to it.
we have some ideas, so we can talk about
Good, good.
it.
But do you think it matters what size of a company it is? I mean, you kind of also mentioned, we talked earlier, the HR teams are getting smaller, there's more on their plate, right? If you're talking about a 50-person company versus 5,000 versus 500,000, I think kind of a little bit of the law of large numbers on one end, that would be sort of my hypothesis that you can measure, even though we're very skeptical in productivity measurement outside of just pure outputs that are, I'll call them widget-like, and I don't mean manufacturing necessarily, but so just curious if you think there are differences in how you measure that well-being, wellness ROI, depending on the size of the company, or
I think you can. I think the smaller employers, it's more challenging. I have employers that have high turnover. It's challenging. Manufacturing, one of our clients is a large manufacturing, and their turnover is like 17 to 20% every year, and they are very highly invested in wellness. And the CEO said, we're investing in wellness, and then the people are going out the door to someplace else. We're getting them healthy and well, and they're leaving to work for another manufacturing company for an extra dollar an hour. So I do
yeah,
think employers have to decide where their money is best spent, and invested with their employees. The smaller companies, so we're slightly under 80 employees, and what we find is that our employees that are engaged in various aspects of wellness. So we have one employee who's certified in meditation, and every other week she does a meditation in the morning. Very first sort, and maybe only 10 or 12 employees participate, but those 10 or 12 employees that participate are very grateful. And
hmm
so it really depends on what touches the employee and how they can fit it into their schedule and how important it is to them. So it is very hard for us. Like we're,
yeah,
again, slightly under 80 employees, and we are fully embrace well-being, but it is hard for us to say what the ROI
yeah.
is, other than we know we have happy employees that participate and they build our culture.
When you think of your clients and the benefits that they purchase for their employees, what we've seen, and just curious if you're seeing the same thing, that it's no longer for the individual, it's more about family units because there is a lot of focus now on caregiving. There's a lot of focus on retirement and fertility. I mean, it goes across all facets. Do you see that when employers are choosing these solutions? Like, how is it aligned? Is it more towards families now, or are they still looking at individual needs?
So we feel that the future of designing benefits is got to be including family services. It's infertility, it's caregiving, it's mental health, it's maybe financial resilience or understanding, it's 401k. So we take a holistic approach when we look at a client. We don't actually take on a client if we're just picking up one product line. Like if they want us to handle their medical plan, we are going to handle all of their benefits because we look at it from a holistic standpoint. Like it's medical, dental, life, disability, long-term care, short-term disability, whatever it is. The 401k could be separate, but we have a 401k specialist who actually will integrate HSA education, financial education into the benefit package. So a lot of our clients have all of their products with us because we can take a holistic approach of not only communicating, but kind of designing plans that best meet their employees' needs. So we really do believe that employers that are focused on family needs as a unit are critically important. I mentioned I have two daughters, right? One of them is just turned 36 and she would love to be pregnant soon. She just got married a year ago, and God willing, she will be pregnant. But at 32, she went through a process of freezing her eggs. And
Wow.
now, and I share this because as the listeners, 50%, so I went with her when she was 32, 50% of the people in the infertility clinic at Boston IVF were there to freeze their eggs.
Wow.
50% were there for infertility reasons. Jessica's employer offered a stipend for family planning that included a small fraction of money that helped her with this process. That was
Incredible.
an amazing benefit.
Yeah,
Yeah.
absolutely.
So, and today it's almost common for young women in their early 30s to talk about freezing eggs. And so that needs to be something that's addressed. And employers who embrace some type of opportunity for family planning are including that benefit. And that is attractive to young women who are looking to have a career and a family down the line.
Yeah,
I
I mean, we
mean,
see it as well. So we work with fertility clients, and we see a whole spectrum, right? It goes from planning, it goes through infertility, some of them do freeze their eggs, right? So it's a whole spectrum. And, they come into coaching because it's a big, mentally wise, like emotionally,
Huge.
like it's huge. It's a huge impact on your
Huge.
health, right? So yeah, I don't know where I was going with this, but I was just saying that it's super important, to have a full range of these benefits because life ebbs and flows, right? So planning for the whole spectrum, the continuum of the family.
So that's
both.
just infertility. Oh, I'm sorry.
No, no, go
I was
ahead, go
Good.
ahead.
just, I was going to give you another example. So we also have a client who was having high degree of turnover, and it wasn't due to the medical plan. And we were trying to help them figure it out, like, what can we do to help
Mhm.
support you? So what they were doing was capturing information in exit interviews. And in the exit interviews, most of the people were saying, I can't afford to work because I have children in daycare. I can't find daycare. I have no access to daycare. I can't afford daycare. My
Yeah,
mother-in-law takes care of the kids. So what we ended up doing is partnering with a company called Hey Mirza, and they are a platform that allowed us to go in and find all of the opportunities for daycare and
Mhm.
subsidization, cost and paid for by local governments. There's all sorts of
amazing.
stipends. Totally changed the game. Like we put this in as a pilot for this company, and we love pilots. Like if we can find a problem and find a solution, we'll put those two together. And that was a game changer because they realized that the biggest issue was it was caregiving.
But also
Yep.
kudos
And
to this employer for actually listening and for reading this exit
yes.
interviews. Because a lot of the times, they're filled out, it's a check mark, that's it, never to be looked at again. So it's incredible that that step was taken.
And then we can use that story for the next client. We're aware of what could potentially be a challenge for the next client.
Learnings.
Both of you mentioned the word or two words, mental health, in some of the discussions, and I think if you rewind back right during and right post pandemic, mental health was the number one challenge for corporates and employers to solve, right? Now that prevalence has not decreased to our knowledge. There's still a high rate of diagnosed with anxiety and depression, especially amongst the younger adults. Do you see that mental health is still taboo? Is it still on top of the employer's list to be solved for, or has it started to fall off the top of the list just because of prevalence?
So I see it as less of a taboo, but still very misunderstood.
Mhm.
And my thought process is it really should be embedded in healthcare. What we have with mental health is um, lack of access, lack of affordability, and lack of integration, right? It's mental health. If you were to fall and break your arm, you can see somebody has a broken arm, right? It's so visible. You get so
Hmm.
much, I'm sorry, how did it happen? But if you are having a mental health condition, it's hard to see that person as having any challenges if it's not a physical, outwardly appearance of a challenge, a medical challenge. And that is part of the stigma, right? To say somebody is depressed or they're sad or they're stressed, whatever
Yep.
mental health challenge they have, I think is difficult. So I do think that we need to continue to do a better job of making it sure it's embedded in healthcare. But the access to mental health professionals is just as difficult as the access to primary care doctors today and the
Yeah.
access to care, the quality of care. Um, I have a niece that, I rely on a lot of my own personal stories who had some challenges with bulimia and anorexia, and it was such a challenge, even with all the physicians
Mhm.
we have in our family, getting her to the right care. Fortunately, today she's a freshman in college, but she missed a whole year of her high school experience because of the access to healthcare and to navigating the system and inpatient, outpatient. And we just got lucky. I mean, you
Yeah.
have to be your own advocate today in mental health. And there's not a lot of opportunities for assistance, depending on the type of mental health. And it was a full court family press, and this was my brother's child. It was full on.
Yeah.
My family, my sister got involved. We all got involved to help
Yeah.
our niece, because she was at a pretty bad level. We finally got it, and then you had to stay on top of it.
Yeah.
So, what's that say about the mental health system for children? She was a
Yeah.
child
And
at the
mental health is
time.
it's also so multifaceted, right? You mentioned depression, you mentioned sadness, and yes, sometimes you can see that outwardly, if somebody is not doing well. A lot of times we all got so good at putting these faces on and these like
Right.
facades, and nobody really knows. I mean, we say this all the time, what somebody is going through. We mentioned infertility, right?
You
Again,
don't,
there's so much, it takes such a toll on one's mental health, but not anything you would think of, not anything you would talk about. Caregiving, there's those who take the sandwich generation, right? We talk about that all the time.
yeah.
There's so much mental strain that goes along with that.
Let,
So, I
let's
mean,
use the
we
example
go,
of the broken arm, right? If somebody is
yeah,
exercising every day and a broken arm and they can't do it, and that's dry, I mean, it's not necessarily depression,
Yes,
but there's definitely stress levels that rise with
absolutely.
it.
but
So
not only depression needs to be treated, like mental health, again, it's a whole spectrum
spectrum.
of concerns and issues, right? So, yeah,
Are we,
well,
It's a
are we,
challenge, and that's where I do think that coaching comes into play, like helping people. Sometimes it's just listening and guiding or listening and supporting. Sometimes you just need to vent, right? Like this isn't working. How do I get there? And then
yeah.
you move forward.
I mean, we always talk about this, right? Because we have programs in caregiving and obesity and oncology, right? But and we have specific mental health programs as well. But mental health is always an aspect of every program we ever offer because somebody who is overweight, they're struggling, they're not overweight because they love food so much and they just want to be eating delicious stuff. Most of the time
Right.
that is not the case. There's a lot that's underneath that, right? And mental health is a huge aspect. And, that's why Eugene and I always talk about this, that there's still so much education that needs to be done because I know all of us, like we live in this world and it's just so familiar to us, but most people just really don't realize
Oh,
how
I
huge
agree.
mental health is. Yeah.
100% agree.
I'm glad we're on the
This-
same page. Are we ready for
I,
the
I
finale here? I'm always get excited. I always
the
get
big
excited
finale.
for the rapid fire.
I know this has been so much fun, but I'm looking at the time. I know we should wrap
Yeah.
up, but it's been like so great. Okay, rapid fire, two questions. The first is, what is one misconception about HR that you would love to bust?
Okay, so um, the one misconception that I would love to bust is that HR is like the um, soft place, like HR just does their thing, the trains run on time. My response to that is HR is a critical function in every company. They are part of our strategy. They are the heartbeat of our company. They manage our people. They manage performance. They manage the purpose of what we're doing. The role that HR plays is critically important. So I think if I had to say, what is the myth? Oh, we'll just, she's just in HR or
Yeah.
HR needs to be a critical member of the leadership team. So I would say the misconception is, so you love that,
There.
is in reality, HR is the heartbeat of the strategy that we have as a business moving forward. They have to be at the leadership level and they have to be at the executive table.
Incredible.
So that's how I feel about HR. If you want to
I,
bust a miss there.
I know you just made the day of all the HR leaders who are listening to this. I
Oh,
know everybody has
100%.
a little bit of a fuller heart
Underrated,
today. Yeah.
overworked. I know. So I'm going to call out my own HR professional, Amy Sabato, is amazing. And I don't feel that she often gets all the credit she's deserved because she quietly behind the scenes is handling maybe an employee termination and onboarding. Somebody needs to get into their 401k account, payroll. I'm
We'll
just I'm
we'll
not
we'll
even
cut
doing it
we'll cut this
justice.
20, 30 seconds and we'll send it to her.
You
And
should send it to her.
we're sending her lots of love and appreciation for everything
Yes,
she
no,
does
no.
every
But
day.
that's the myth I would bust. Like you have to have respect for these HR professionals, what they deal with, and the ever-changing landscape of compliance and taxes and everything that goes into that HR piece.
Amazing.
So,
Amazing. And I hope
okay.
everybody who's listening who is not an HR leader is going to be a little bit nicer to their HR people today.
Yes, yes. There should be an HR professional day, but I don't know if that actually exists. Um,
You know what?
so,
We'll look it up. If it is, we'll make sure to mention it on our socials next time it rolls around.
oh, that's great. That's great.
And then our favorite question, we talked about a lot of topics today. We know where we could do a little bit better. So if you had a magic wand, what would you do today
What would I do for
to move the needle?
healthcare to move the needle in healthcare? Um, that's an interesting question. I think benefits are part of every firm's culture, not just an expense, but they are part of the lifeblood of a company, like benefits as in whole. I would say the magic wand is that you really need to understand the data, understand your employees, what they are looking for, because there are ways where you can be providing all sorts of great benefits and all they want is extra time off. So what are you doing, right? Like really take the time to understand their magic wand. There is no magic wand. You can move the needle by really paying attention, asking the questions, understanding your costs, understanding what's driving the success of your company. And if benefits are a big part of it, then focus right on that area and provide them what they need. So I think we can move the needle. I don't have a magic wand. I wish I did.
That's actually one of my favorite answers to this question because we don't need magic. This is actually really, really simple. If we just listen, we
Mhm.
could actually move that needle. So I love that. It could not be better said. On that note, Jen, thank you so much for joining us live. If you're listening to us on YouTube or on our podcast, please do like and subscribe as we have many more disruptive dialogues coming your way. If you have any questions for Jen, our team at Your Coach, or future guests, please do reach out to us, team@yourcoach.health. Let's move that needle together. Thank you.
Thank you.